You're watching an extreme makeover edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is a cosmetic dentist that is getting a lot of attention lately because of the results she's getting with her patients. If you are unhappy with your smile, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. April Ziegele. Dr. Ziegele is the founder of Ziegele Aesthetic and Restorative Dentistry of Sumner, Washington. Dr. Ziegele, welcome to the program.
Thank you. It's a pleasure to be here.
Now, before we get into today's topic about what's new in cosmetic dentistry, tell us about your practice.
Well, Randy, we have a practice, as you said, in Sumner. It's a small town in southwestern Washington, right next to Puyallup. And we do general and cosmetic dentistry. But of course, all of our cosmetic dentistry is also part of our general dentistry. It doesn't matter what we're doing, if it's crowns, veneers.
You always want to make it look good.
I always want to make it look good. I don't want to have it look like dentistry. I want it to look like a fabulous, beautiful, natural smile.
Okay, what's nice is your teeth are fantastic.
Thank you.
Have you had anything done on your teeth?
I have just whitened my teeth and done Invisalign.
Okay, so you just naturally had pretty good teeth.
Yes, I was blessed.
All right, now how long have you been in practice? You look very young.
Thank you. I've been in practice for 10 years, right in Sumner. I've been there the entire time. And I really love what I do. I have a great time doing the smiles for our patients. And it's fun for me to be in a small town because we get to see them all the time. Grocery store, wherever we go.
Okay. So who is your typical cosmetic patient?
My typical patient is the executive down the street, the housewife, the mom who's had her kids mostly grown up, grandmas. It could be
grandmas,
the mechanic.
Is that right?
Lots of grandmas.
Are the patients getting older and older for cosmetic procedures like veneers, or are they getting younger and younger? What is it?
I think they're getting older and older. They don't want to go through all the years of braces. They want to have something beautiful. They're tired of their grandkids asking them why their teeth are yellow.
Is that what they?
I hear that all the time.
Okay.
Yeah. Especially they'll tell them their teeth look like corn or butter.
Is that
Who
right?
wants to look
so
like
that?
that?
So that motivates them to go get something done.
Kids are brutally honest.
Okay.
They'll say just about anything. So, you know, it used to be a very typical patient, someone who was more affluent, and it's everybody now.
Everybody's doing it.
Anyone who's tired of having their smile not the way they want it to be.
So if they don't like it, which seems obvious.
Well, it could be something little, but they obviously don't like it. They realize they take their smile with them everywhere they go. Everyone sees it everywhere they go, and so they contact us. Well, you know, Randy, one of the things we see is people who are going through a midlife crisis, or they've just gotten a divorce, or they're starting over again in any aspect of their life. They're dating again. They have a new job, or they'd like to have a new job. We see a lot of mothers of the bride. They know that their daughter is going to take the center attention for everything, but they don't want to look old, you know, in all those wedding pictures. It could be someone going back for a high school reunion. They don't want to look old either, as you can only imagine. So it's whatever anybody wants to do to look younger, feel better, look more healthy and vibrant.
Let's start with your training when it comes to cosmetics and veneers.
Well, you know, in dental school, there's no time for it. They can't train
Not a lot
everything.
of training about veneers in dental school?
No, not really. I mean, they're barely touching the edge of composite bonding materials. They just really want you to pass your boards.
Okay.
So if you want to do something beyond that, you really have to go get the training yourself. So I went to the Las Vegas Institute, took several courses there, trained with the best in the world. There's no question. Dentists come from all over the world to take classes down there. It's the elite.
So it's a place to go to learn cosmetic dentistry.
It is the place to go to learn it.
Now you say there, and we've talked on the phone, there's a lot that I feel I could spot veneers 20 yards away.
Yeah.
They seem big and bulky, and you say it doesn't have to be that way.
It doesn't. That's where the artistry in cosmetic dentistry comes into play. If the dentist isn't experienced, they don't know what they need to tell the lab to get it done. It really all is in the hands of the artist to treatment plan it all the way through.
You say artist, you consider yourself an artist?
I do.
Is that right?
I do. Dentistry is, well, cosmetic dentistry is way more of an art than it is even a science.
Would you say 70% art,
Yeah.
30% science?
I would. You have to have an artistic eye if you're going to go into cosmetics. If you don't, you really don't belong there. Do something else.
So with cosmetic dentistry, what's changed in the last 20 years?
Oh, in dentistry, I think every 10 years is a completely different field.
Okay.
Veneers used to be big and opaque and kind of chalky looking, where you could spot them.
Yeah.
It didn't matter.
I told you, I still think I could spot them.
Yeah.
So that still goes on.
It does, sadly, because you know what? If you're not staying up on the latest, You don't know what's out there.
Meaning the dentist doesn't know what's out there.
The dentist has to know. And, you know, in our state, we only have a requirement of 21 hours a year of education for our dentists.
Okay.
That's abysmal.
Is that right?
21 hours. And they can take it online. Well, I don't think that's nearly enough for me to stay ahead of what's going on.
What do you do? You go to conferences?
I do. I go to conferences.
But is there that
I go
much
to
to
classes.
learn, really, when it comes to creating
It's surprising.
a new smile?
It is surprising. Last year, I got 194 hours of advanced education. Over half of it was hands-on. So, you know, you have to travel all over the place to get it. You can't just take it in your own backyard. And I don't think that dentists do that because it's a lot of work and costs a lot of money.
Now, I interrupted you and we were talking about what's new in cosmetic dentistry. Okay. So the teeth look more authentic than ever. What else?
Teeth look more natural. They look more lifelike. The porcelain reflects the light more like a natural tooth would. So they have gotten so good now that even cosmetic dentists have a more difficult time detecting.
You can't even tell, is that right?
You can't even tell. That's really the goal in cosmetic dentistry.
What about them falling off? A lot of that going on?
You know, Randy, we do
that would be
thousands.
my fear, by the way.
Yeah, well, and that would be absolutely embarrassing if you were out somewhere. But we do thousands of veneers every year, probably more than anyone else in the South Sound, and have maybe 1 or 2 come off.
Was there? Okay.
So it's not that big of a deal, and if they do, there's probably an issue with their bite that needs to be addressed. Well, another big change is that the adhesives are so much better. The bonding process itself is so much stronger than it used to be. Once they're bonded onto your tooth, they're stronger than your tooth was to start with.
Okay.
You know, we have so many things that we can do now. We have lasers in our office so that we can do some contouring of the gums. If you've seen someone with a gummy smile, that's kind of mortifying to the person.
Mortifying, okay.
You don't smile when you have a gummy smile. You do
so you can
everything
take care of that, somebody that's showing too much gums, I guess.
Yes.
Gummy smiles, you say.
Absolutely, yeah. We call it a gummy smile. But, you know, people notice it because they show more gum almost than teeth, which isn't a fun experience.
And we've talked, and I told you, I haven't really had anything done to my teeth, so I probably take it for granted that it's pretty important, but you say to some people, their whole self-esteem, their identity is affected by their smile or lack of a great smile.
Yeah, it's very true. We see people who will come into our office and while they're talking to us, they're like this.
Is that right?
They won't even take their hand down. And you wonder, how do you get a job promotion when you won't put yourself out there with the self-confidence to do something?
You think it's pretty important. You're biased, obviously, you're a dentist. But why is a smile so important as you see it?
You know, it is the center of who you are. It's your personal expression of you. And, you know, there's a new study out that shows that in 2 seconds, we evaluate someone on their education, their affluence, their ability to communicate with others, and most of that is in their smile.
Interesting.
2 seconds.
Well, you do remember people by their smile. You know, say, oh, that person had a nice smile. It's also a healthy look, I think. Anticipating this interview, looking at smiles, it's a healthy look, a vibrant look.
It is. You look younger when your teeth are straighter and whiter and not chipped. As we age, our teeth tend to get shorter and yellower and darker and a little more see-through. So, you know, we can restore the youth back to it. And, you know, youth is important in our society. You see it in Hollywood. I mean, even in our shopping malls. You see how people are so obsessed with having a youthful look. And, you know, why are we dyeing our hair and everything else that we're doing otherwise? You know, you look at people and you see they've got everything else all put together. They're dressed snappy. They, you know, their hair's done. They're carrying the newest and latest bag. They're driving a great car. Obviously, they care about who they are and what they look like. They may not know that they can do something about their teeth without the fear and the pain.
Do you see it? I mean, these well put together, let's say, men or women, and they obviously care what other people think. That's why they have, I guess, an $800 bag.
Yeah.
But do you think... I mean, do you ever see them in their teeth? I mean, as a dentist, obviously, you see their teeth and you say, boy, I wish they...
I do, all the time.
Oh, is that right?
Yeah, well, you probably have seen it too. You just didn't think about it. You know, when I look at a smile, I look at so many different things than just teeth.
Yeah, I think it's a very attractive look. There's no doubt about it. I mean, if somebody has a great smile, it's great to look at.
Yeah. Well, it does. It grabs your attention. You remember them more. You think about that person. That's why we have people coming to us saying they want to look like Halle Berry or Julia Roberts. They've remembered that smile. It's just what makes that person have that vitality and that youth and just really shine for them.
So it really affects their self-esteem.
It really does. You know, people don't have a confident smile. They aren't confident. And so, you know, I brought
Do you see transformations, by the way?
I do.
You fix their smile and all of a sudden...
I do. That's what's so fun for us because we do live in our community that we work with the people. And, you know, I brought some before and after photos to kind of show you what we can do for them.
Okay, let's take a look. Let's take a look.
This is a patient who came to us.
That's a great smile.
Yeah, it's a great smile. She had a lot of old bonding done, which if you've gotten to your 50s, you have a lot of old fillings, you know, gray fillings, different things like that. Her teeth were not straight. She didn't like that. Her granddaughter told her that her teeth looked like Indian corn.
Like Indian corn.
That's what she came to us for. So, you know, she'd had a lot of old dentistry and it didn't match. So many times, you know, you get crowns or whatever else and they don't even match each other.
It's a great looking photo here.
Yeah, what you want to
these are
notice,
great teeth.
Well, yeah, they are, because they look natural. And the reason they do is, you notice they follow her lip line. They fill out the sides, what we call the buccal corridor. It fills it out, so she has more teeth that you see when she smiles. It's a big, wide smile. It is. It's a very natural, vital-looking smile. It's lined up. It's not straight across. Doesn't look like a denture.
I mean, I told you this off camera, that I see a lot of veneers, or whatever they are, they look like dentures straight across. This is very nice, and they almost seem to get smaller as they go back.
Yeah, and that's what a natural smile
But this
does.
is in the hands of the dentist, you say?
Almost exclusively.
But logically, don't dentists nationwide know? Don't do it like that.
You know, we're trained on to look at teeth in dental school. Just the teeth. Restore the tooth. Drill and fill.
Drill and fill. Okay.
Drill and fill. And then, you know, when you get out, it's almost a lot of unlearning to do. Because when you're doing cosmetics, there's so much more to look at. You need to look at their entire face. You need to see, does things line up? Are their eyes straight with the floor? Are their teeth straight with their eyes? Is their midline straight in their face?
What's midline?
Straight down the middle of their face, right in between the two front teeth.
Okay.
If you look at someone like Tom Cruise, he's off, way over here.
Really?
He's off, so he holds his face.
Surprised he gets an acting job if his midline is off.
He's obviously got charisma.
It's not affecting his career.
It's not affecting his career.
So now with this woman, natural looking smile. And like I said, I could spot veneers walking down the street. If she walks down the street, you would just say nice smile.
Yeah, and she tells us, she has people stop her all the time, telling her how pretty
Now
her
why
teeth
know
are.
before on some of these?
You know, because we are in the community where our patients live, and I don't want them to feel embarrassed that people can then see what they really had. Most of them didn't smile before, so no one knew.
So on a consult, she comes in, I mean, do they just tell you, I don't like this, I don't like that? What do they say?
They tell us a little bit, but you know that our job is to ask enough questions to find out what it really is about their smile that's driving them crazy. Because there's something, and they're not real wanting to tell us. As you can only imagine, it's been bothering them a very, very long time.
Okay.
So we look at a lot of pictures, kind of get an idea of what they want to have.
Do they know, are patients now more informed than ever, I guess because of the internet, shows like that, they come in and say, this is what I need?
Yeah.
Do you get a lot of that?
We do, but then our job is to kind of make sure they're not going to head down a path that is not right for them.
Okay.
We kind of guide them into what is possible in cosmetic dentistry. But yeah, patients are very, very educated on what's available.
You say you teach people how to smile again after you fix their teeth. What do you mean?
Well, when they've had years of being embarrassed by their smile, most people don't smile. It takes a while for them to learn again that they can smile and show teeth. Our patients have told us that before, when they had their smile, they were perceived as being angry or closed off or just an absolute unpeople person, unfriendly, because they didn't smile. You know, you can only imagine if you're holding your lips shut, it looks like an angry person. It doesn't look like a friendly, open, accepting kind of person to be around. And so, you know, whether or not you are that way, people perceive you to be that way. So once they get their new smile, it's a whole learning process.
So are they more outgoing? Do you have any stories where they say, oh, I met the man of my dreams or got a better job? You do hear those stories?
We do. Yeah, people change all the time. As soon as their smile changes, they're so more outgoing. We see men shave off their facial hair almost rarely. Almost never keep it after their smile has been redone.
Wow, we're going to take a quick break. We come back. The process, I want to know what, if somebody, they don't like their teeth, what happens on day one, the whole process of getting veneers. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. It's all about extreme makeovers today. We're here with Dr. Ziegele, cosmetic dentist, that everybody seems to be talking about. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in cosmetic dentistry? With us, we have cosmetic dentist, Dr. Ziegele. Now, are more women coming in than men, for the most part?
Yeah, actually, we do have more women. I'll go through some photos, kind of give you an idea. This is Lisa.
All right.
Lisa came to us because her teeth were very short. She did not like how short her teeth were. She thought it made her look like a child. So
little teeth, I see that.
Little teeth. So we were able to contour her gums with our laser, as well as give her some porcelain veneers. And you see, she has a beautiful smile.
Yeah, very nice.
Yeah, she's very, very happy with her smile, and she smiles all the time.
Okay.
Here's another woman. This is
Okay.
Gail. She came to us because her grandchildren and her daughters thought she looked old, and she did not like her old dentistry. She had dark gray lines up at her gum line where she had old crowns, and she wasn't happy with that. So we did 10 veneers on her. Her teeth match her age. She does not look like we put 20-year-old teeth in her, but
Well, what would 20-year-old teeth look like in a younger person? I mean, what's the difference?
yeah, well, you can see them. They have little ridges at the bottom of the teeth. Those are the very young teeth that haven't had a chance to wear it down at all yet. And they're not quite, they're much whiter, they're more vibrant, but you don't want that. When you're in your 50s, you don't want to look like you have fake teeth. You want to have something that looks natural.
Okay.
I don't want them to look like those fake veneers you mentioned.
But
that
you say
can see.
men have different teeth than women.
Absolutely.
How so?
Men's teeth tend to be more square, more masculine, a little stronger looking teeth. Women like the more softer, rounded edges. And that's all in the customization that we do. We want to make sure that we're giving somebody a smile that, while it's what we think is beautiful, it's exactly what they had in mind. It looks like them,
Okay.
only better. Okay, this is another one. She came to us because she'd had a lot of old
Beautiful
dentistry
smile,
done.
by the way.
Yeah, she's very happy with her smile. She was a salesperson,
Okay.
as well as a mom, and she really felt like her teeth were old and worn out. They were very, very yellow. They were very, very short. She had a lot of spaces between her teeth, and she'd looked in doing orthodontics and whitening, which of course isn't going to straighten out what she wants, and would have taken her about 5 years to get it done.
This is very nice. And these aren't big and bulky.
No.
All of the teeth that I'm looking at, it was very, very nice.
Yes, her teeth are very natural. She gets compliments everywhere she goes. We did.
Is that what they say, by the way? They get their teeth fixed and people start saying, wow, look at your teeth. Or what?
Yeah, well, they don't really say, look at your teeth. Most people ask them, wow, you look so rested. You look younger. What did you do? What did you get done? And it's one of those nice things where, you tell them or don't tell them. It's your own personal preference, but it's something that looks really great. This is another one.
Okay.
She had old dentistry that was all failing. It was just completely crumbling in her mouth. And if she didn't get something done, she was afraid she'd lose all of her teeth. And likely she would have. So we completely restored her entire mouth, restored her bite to an appropriate spot, and
So what'd you
gave her
do?
a beautiful
what
smile.
does she get? Just veneers?
She did veneers and crowns, combination, and it's
So
her
even
entire
somebody
mouth.
with unhealthy gums or they're having dental problems can get veneers.
Well, absolutely, and that's what we
Okay.
need to make sure, is that we make sure that the gums and the bone is all healthy around
Okay.
what we do. If we don't give them something they can easily take care of and keep clean, it's doomed to failure. I see that all the time, and if they aren't taking care of it, it won't last.
Okay. Now veneers never stain as well. Is that right?
That's correct. That's the beauty of porcelain, is that it doesn't pick up any stain. In the Northwest, we're kind of obsessed with our coffee. So
Right.
natural teeth and bonding all stain. We call bonding more like Tupperware. If you stick it in the microwave with spaghetti sauce, it's gonna stain.
Okay.
And that's just what the bonding does too. So, it picks up red wine, it picks up smoking, it picks up coffee.
So with veneers,
They never stain. They will always
Okay.
be the color that they are when we put them in. So once you pick the color, you're going to stay that beautiful white smile forever. This is another one. Her situation is really fun because she had actually had old veneers on her teeth that were failing, and they were not very pretty. So we were able to completely remove them, restore them, give her beautiful smile again. Her smile is natural and her age appropriate, and she
great
loves
smile.
it.
Great smile.
Yeah, she has a great smile.
Now here's a guy we're looking at here.
Yeah, this
Finally
is
a
a guy.
guy.
Yeah, finally a guy. He had old dentistry as well, as you can only imagine most of us do as we get older. And he really wanted to have a nice, healthy looking smile again. He's put his boys through braces.
Now, that's a great smile.
Yeah, he has a great smile because it follows the contours of his lips. It fits with his face. It fits with his overall proportions of his body. It fits, with his skin coloring and his hair coloring. All of that needs to go into our consideration for what
Guy
we
looks
do
like
for
a model,
smile.
by the way.
Yeah, he's a good-looking guy, isn't he?
Yeah, yeah.
His wife really likes his pictures.
Looks like
now.
you got him off a dental website just to show on the program. So he really looks good.
Yeah, this is another gentleman that came to us. He had broken his two front teeth. And the reason his teeth had broken was because his bite was so badly aligned. So he had the choice. He could go through braces for 5 or 6 years, possibly break his jaw to correct this issue. But we were able to correct it with porcelain. So
Do you do Invisalign, by the way,
we do.
at your office? Okay.
We do. It's a nice little thing to have, and adults like it so much more than traditional braces.
And this guy looks good too. Another model, looks like like a older, healthy looking person.
Absolutely.
And those don't look like phony teeth either.
No, they don't. In fact, his own son didn't quite recognize what he had done. Loved it. So he's a patient of mine now too.
Looks like a businessman, like a very successful businessman. It seems with all these shows that there's, with all these photos that you're showing, that it's almost like a class difference. They seem to be more sophisticated, just because of their teeth.
It's
you
amazing.
can't help but judge people too when you see them. When they're squared away, their teeth look good.
We do. We judge in America immediately. You decide what someone is, who they are by the condition of their teeth, and it's an immediate thing. And when we restore their teeth, it's everything about them. They change their hair, they change everything to look like a totally different person. They feel so much better about themselves. Do I have time for a few
Sure.
more? She had old bonding, just wanted it replaced, wanted a beautiful smile, so we were able to do 10 veneers.
That
for
is
her.
a great smile.
Give
By the
her
way,
a
are
great,
these
beautiful
some
smile.
kind of glamour shots you're sending? Because they're all posed.
Yes, we have a photographer that takes our after
So
photos.
you fix their teeth,
Yes.
and then you give them some sort of a glamour shot.
We'll give them a great picture.
That's great. That's great.
Well, they need to feel good about themselves. She came in after her dad had his entire smile done. She wanted something done. She'd noticed a space on the side of her mouth when she smiled in pictures and didn't like it. So we were able to restore everything for her, give her the beautiful smile
Looks
she's always
good.
wanted.
Well, these are great smiles.
Yeah.
Here's a happy lady right here.
This lady, we can't get to stop smiling.
Okay.
She's thrilled with her smile. She wasn't smiling before. Her grandkids were
When you
pointing
see a
out.
person like this, you can't help but want to smile too. I mean, This is a big smile.
It's
very
a big
nice.
smile. She's thrilled. Can't stop smiling. This lady too, she did it when her husband died. She wanted to do something to feel good about herself again, and it's something she and her husband had always wanted to do for her. So she couldn't be any happier to get her beautiful smile back.
Okay. So the process. Somebody comes in, they don't like their smile. They meet with you.
They meet with me, or they meet with my team. I brought a picture of my fabulous
Picture
team.
of your team. All right.
Yeah.
Bunch of great smiles here.
Great smiles.
Did you
great
do all their
ladies.
teeth?
I did.
Okay.
I did. And we are all so interested in what we can do to make their smile better. We sit down and talk to them, make sure we understand. We're going to go over pictures with them. We might do some models.
How much say-so do they have in their smile of what's going to happen? Because that seems my fear. I don't know what I would look like.
Absolutely. Well, they get almost 100% control in that. We're going to make a wax up for what we think that they want. We're going to ask enough questions to be pretty clear about what it is they're hoping it will look like when they're done. And then that's kind of a trial run. They get to see them outside of their mouth. What's it going to look like?
Okay, so they look at them.
They get to look at them, see what it's going to look like. And then when we get them in and prepare their teeth and put their temporaries on, that's like a trial run of their veneers.
So they get a temporary set.
Yeah.
Made of what?
Made out of an acrylic material, so they're highly polished.
They can eat with them?
They can eat with them. We don't want to eat anything real sticky.
So when they look at the mirror, they're looking at this new smile for the first time. What do they say? You see a few tears?
Oh, we see a lot of tears. Yeah,
Okay.
We have a lot of tears. For the first time, they see themselves the way they always wanted to be, the way they feel inside, but aren't presented to the rest of the world. So it's very exciting for us to see that. And and that's the trial run where we can change the shape.
So what do they
length.
say? I don't know. These are too big. Does that ever come up?
It does. And that's very easy to adjust. We do all of that adjusting in the temporary stage. We make sure they can speak clearly when they have those on.
Okay.
We make sure it's a color that they like, the shape, the length, everything about them. We make sure everything. It is just a trial run.
So from beginning to end, if somebody watching this goes in, they don't like their smile, and they're a candidate for veneers, how long?
2 weeks. Start to finish. 2
Really?
weeks. Yeah.
And now you use terms like instant orthodontics. What does that mean?
Instant orthodontics is a combination of veneers and crowns that we can correct the bite at the same time that we correct the way the teeth look. I mean, you could go through orthodontics or braces, take 4 or 5 years to get done with it, and then we hear from our patients that they have straight, ugly teeth.
Okay.
So this corrects it all in one fell swoop. You get the bite fixed, the beauty fixed, they're straight, they're white, they're restored completely.
So from beginning to end, they come in, and 2 to 4 weeks later,
they're done.
better smile.
Beautiful, healthy, natural looking
What
smile.
about pain through the process? Something they complain about?
Most of our patients don't complain about pain. It's really not that much more aggressive than a filling.
Okay.
So we handle it that way. Obviously they're numb throughout the procedure because we don't want anybody to have any discomfort.
Is it like a twilight type of a sleep? What? Just.
Well, we do. We have sedation we have some patients who get very anxious, as you can only imagine, with bad experiences.
Okay.
You would. And we can put them to sleep with conscious sedation. We also use anesthetic to make sure everything's numb. And, in the hands of a cosmetic dentist who knows what they're doing, it's very, very minimal prepping.
What should somebody look for? And we are out of time. What should somebody look for if they're going to pick a dentist that's going to do this?
Well, you want to make sure you have someone with a lot of experience. There's no recognized specialty of cosmetic dentistry in the United States. So anyone can say that they're a cosmetic dentist. So you want to make sure, do they have a lot of experience doing it? Are they learning on you, or do they already know what they're doing?
Does that happen?
It does happen.
Okay.
They can take a weekend online course and say they're,
Is there a steep learning curve when it comes to this?
I think that there is.
I mean, are you that much better now than you were, 500 smiles ago?
So much better now. And my expectation of my work is so much higher than it used to be.
Are you a perfectionist?
I'm very perfectionist. It's all about the details to me, and that's kind of what gets it exciting, because when you look at one tooth, there's about 100 details in that one tooth that, if they're off, looks odd to somebody. And if you're not into the cosmetic end of it, you won't even notice it. But you'll notice something's wrong.
Okay, so my question of what you should look for. Look at their before and afters.
Make sure they haven't bought their pictures online. Make sure they are their patients.
Interesting.
Look for memberships in aesthetic associations. The American Academy of Cosmetic Dentistry, the International Association of Comprehensive Aesthetics. Are they members in good standing? Do they go and take the courses with them? How many hours of hands-on education do they have?
Okay.
Are they doing the minimum?
But again, the art. But the only way you could tell, if we've all had bad haircuts.
Yeah.
So the art, I guess, can only be judged by their before and afters.
Right, and talking to their patients.
Right. So you love this.
I do. We have the happiest patients of anyone. We get to change their lives, and that's what makes it so fun for us. We get to know them so well, and we love going through the process with them and seeing their lives change. Everybody would like to have the kind of practice that we have.
So where does it start?
If you don't like your smile, you need to find out what your options are. Get on our website, aprilziegele.com, or give us a call. We're happy to get you in. Our consultations are free. You need to have a time to find out what you can have done to change your smile.
All right. I want to thank you for coming on the show. Very good. Very good.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.